Welcome to our next in a series of interviews with different members of the SIREN team. I'm Jonathan, I'm one of the clinical research fellows, and it's a real pleasure to have with me today Sophie and Jenny from the business team. Thanks for joining. Jenny, SIREN has a lot of different team members, a lot of different roles. I wondered if you could tell me a bit about what you do and what your team does.
Yep. So as part of the business support team, we assist with the finances of the study. So with this, we manage finances with NHS sites. And with this, it's really just making sure that sites are paid and paid on time. So you can imagine March was quite a busy month for us. Another role that we help with is that we manage the risk register. So with this, making sure that risks are identified and mitigated. And because it's quite a complex study, we have quite complex risks. Another role that we help with is our quality control. So with this, things like protocol deviations and protocol breaches with sites and making sure these are recorded and escalated when needed. Another role is our emails. So with this, we manage 3 email boxes. And with this, it's really just making sure that participants and sites, their feedback and their queries are heard and resolved and escalated when needed.
Thank you, Jenny. And obviously, SIREN's constantly adapting and changing. I wondered about participant feedback and how you do that within SIREN.
Yep. So as I mentioned, we manage 3 mailboxes. So with this, it's really just creating an email feedback loop with participants and sites. So a recent example of this is our tube lids were too tight, and with this we identified this with participants and we were able to go back to our manufacturers and resolve this issue, and this was all through the mailboxes and these constant queries that we were able to manage. So with this, we also have other forms and platforms for this. For example, we have our All Sites Debrief, our PIP and our PI forums, and it's all just creating a place for participants and sites to feel heard.
Thank you. Thanks for mentioning the PIP, the Participant Involvement Panel. Can you tell us a bit more about what that is?
Yep, so with this, it's 9 participants that volunteer every 6 weeks. And with this, they give us feedback and their opinions and preferences are heard. And this is essential, especially in the planning phases of SIREN, and making sure that they're implemented and participants really feel like their voice is heard and it's actioned.
Thanks. And can I ask you about formal evaluation and how that features in SIREN?
Yeah, so we have a newsletter that we send out monthly, and this is an avenue for participants to provide us with formal feedback, so through our feedback form, and again, this is implemented.
Thank you so much. Sophie, I understand you've been working on the evaluation for the winter pressures sub-study. Can you tell me a bit more about that?
Yeah, of course. So for context, SIREN's winter pressures sub-study was kind of an expansion of existing SIREN, which looks at COVID, into also testing our participants for flu and RSV. So we're expecting really high levels of these diseases over the winter of 2022 to 2023 as the kind of reduction of wearing face masks and social distancing. We're expecting a real spike for that winter, obviously creating a lot of pressure on the NHS. So SIREN was able to leverage our existing cohort and widen into looking at those 2 diseases as well. So what the process evaluation will do is kind of take a look back at how setting up that sub-study went and the process of implementing it, its outputs, its results, and just see what we could do better next time, and also where we did well, and listen to some participant feedback for future winters also.
Sounds like a lot of work. I just wondered if you could tell me sort of more specifically, what are the main aims of this evaluation?
Yeah, of course. So I think there's kind of 3 main aims that we're working towards with this evaluation. Firstly, and importantly, is just understanding participant feedback. So seeing how they experienced the study, seeing if there's anything we could have done better from their perspective, or anything that we're doing well that they want us to continue doing. So that's a really important part of this process evaluation. The other aims that we've got would be looking at the barriers and enablers for all of our kind of stakeholders and collaborators, so sites, labs, participants again, internal UKHSA, and just seeing what enables the setup of the sub-study to go well, and then also what was barriers for it. And then lastly, our third aim is kind of looking at those limitations and near misses, so what we could probably improve upon if we were to do this again.
And can you tell me about how you managed to do that? What were your methods?
So we collected a mix of qualitative and quantitative data. So one of the things we did was go out to participants with a standardized questionnaire. It's based on a questionnaire from the NIHR, but we tweaked it a little bit to have a few more open questions at the end. And that collects a lot of information about their feedback on the study, if they felt well communicated with, if they understood how to access the results, all of those details. So that was one thing that we did. We also held an internal UKHSA workshop, which lasted several hours and was with the SIREN team. And that went into great detail about kind of things that we thought as a team were done well and things that we would perhaps change if we were to do it again. And then lastly, we've got those quantitative measures that track our cohort over time. So looking at things like recruitment numbers, swabs analysed, withdrawal numbers, all of those key figures that allow you to see how the study progressed.
So what are the findings? What have you found so far?
Well, it's I don't want to give too much away, but some of the key findings from the participant feedback questionnaire, which was really well answered actually. I think we got over 1,000 responses, which was lovely to see. And one of the key themes was around this feeling of altruism and contribution. So we've got a sense of contribution both to research and policy, and then also a broader sense of contribution in terms of they've kind of lived through this pandemic as healthcare workers, and now they want to give something back through the sub-study and feel like they're contributing to the knowledge base, which is really nice to see and really lovely to hear. And then also from the UKHSA SIREN team side, we've got some of the key themes emerging would be around communication and collaboration. So it's not only looking at how we can communicate and collaborate internally as our own team, but also how we can effectively communicate with sites, participants, labs, all of the people that we work with to make the study work.
Sounds like a lot of learning. What do you think this is going to change, or how do you think this is going to impact the future?
So I think there's kind of two ways in which the outputs of this study are really important. So firstly, we've got for our own learnings on the SIREN side, looking at participant feedback, understanding their viewpoint. We do get this, as Jenny mentioned, a bit already with the participant involvement panel, but this questionnaire went out to, 1,000. We got 1,000 responses, so it's a much broader base. So it's a really nice thing to have in combination with the PIP. And then it will also teach us a lot about the limitations and barriers and enablers for the study if we were going to do it again. So that's really useful information for us to have. And then on the other side, we've also got kind of providing an example of how you can leverage existing COVID-19 infrastructure to address these wider problems and these evolving research needs, which is really nice. So I know that at conferences, we've had colleagues who have been approached to understand how SIREN has been working and how they've been agilely adjusting throughout the pandemic. And it's really nice to be able to share those wider learnings with the research community. So I think it's relevant to both groups.
Thank you so much for joining, guys. It's been a real pleasure to hear about your exciting work. Thanks. And thank you for listening. You can find out more about all of our work in the next SIREN newsletter, which will come out regularly. And if you have any questions, do get in touch via the email inbox. Thank you.